Okay, so welcome everyone. So this talk is called Using Evidence and Gap Maps to Support a Mid-Level Theory. Approach to, I'm going to put all the words in, approach to building the evidence architecture. This event is a CEDIL webinar as part of the What Works Global Summit Evidence for Development, hosted by the Campbell Collaboration and the Global Development Network, GDN. And so if you want to tweet or anything from this session, from my presentation, please do flag Campbell Reviews, flag CEDIL Program. You can tag me and tag Evidence for Development. There'll be nothing left to actually any space to write anything once you've done all that, but still you would have got a tweet out from the event. you can send a picture. I'm also wearing my Evidence-Based Healthcare Day t-shirt. This Evidence-Based Healthcare was last week, and so we folded evidence-based healthcare for this year for Campbell excuse me, into the Evidence for Development conference. So I've got three parts to my talk. One is about using evidence and gap maps to build the evidence architecture. I have spoken about this previously in a CEDIL webinar, and we have a paper coming out on it that I'll mention, but it's a quick refresher of what we're doing. Then talking about using theories of change to inform EGM frameworks, which I've not spoken about before, but it's something we do. So I'll present some examples of that. And then I'm going to talk about something which is entirely new. It is a bottom-up approach to mid-level theory, which is something we've been doing over the last few months, but I hadn't articulated it in this way until preparing for this presentation. And I mean, what I emphasized in the first part of this talk is one thing that's frustrated me in the conference over the last 7 or 8 days now is a number of people that seem to think that research is still done the way it was done 10 years ago, with no even if it was done that way then, with no intention of trying to engage with policy or practice and changing policy and practice, and no attention really to getting evidence into use beyond maybe writing a policy brief or two. And that is so simply untrue compared to the advance we made while I was at 3IE, the advance we've made at Campbell over the last few years, and the work that CEDIL's been promoting on various ways to support use of evidence. It's one of our programs of work at CEDIL is supporting use of evidence. And so I'm going to be talking a bit about an example of that right now. But we had earlier this afternoon a presentation of the Campbell Wikipedia project, where we have a team of volunteers working to put references into Campbell reviews in various relevant Wikipedia entries, and therefore increase the discoverability and use of evidence from Campbell reviews in that way, with many people, college students, decision makers, and so on. But the approach that I work most strongly on, most of my time actually on, is using evidence gap maps to build the evidence architecture in different sectors, working with what I call user commissioners. So user commissioners are not research funders that just fund research that's research for the sake of doing research and might have some end use, but they're user commissioners. They commission the research knowing how they plan to use it in a particular way to inform policy and practice. And the evidence architecture is this figure of mine from my paper in Nature a couple of years ago. And this is just for supply side. There's a demand side. I recognize the demand side is important, and the paper talks about the demand side. But this is supply side. And the key point I want to focus on in this moment is the top three levels of this pyramid are what I call evidence-based decision-making products. It's not very snappy, hasn't really caught on. EPDMs piece, yeah, I can't say it, but his EPDMPs are evidence products based on systematic reviews that allow decision makers to make decisions based on evidence without having to go back and read the evidence. So other existing evidence products that were out there before, like evidence maps, evidence platforms, and so on, took users back to the research evidence. But the whole point is that practitioners, policymakers don't read research evidence. Those research papers is often not written in a way that's accessible to them, even if they can discover it. And so the point about the top levels of the pyramid is here's an evidence product that allows you to make decisions based on the evidence without having to look at the evidence. And I'm going to give some examples of that. So as we go up the pyramid, it's nothing about, oh, this level's better than that level. It's the knowledge is more heavily brokered as you go up the pyramid. But the other point about the pyramid is to have a top of a pyramid, you need the base. Yes, you can't, the top rests on the base. So at the lower levels of the pyramid, you can't have the top of the pyramid. And that's a key point about the approach that we take. So we work with a number of what are called What Works centres in the UK. What Works centres promote policy across UK, sometimes just England, sometimes Scotland, and so on, in a broad range of policy areas. And the one I'm going to talk about right here is youth offending, and then Thomas is going to be talking about youth employment. So, Youth Endowment Foundation Fund have £200 million from the government, so a lot of money, to spend on supporting research to inform evidence-based decision making. And they both fund interventions to do evaluations of them, and they fund the evaluations, but they're also engaging in commissioning a series of systematic reviews and already have 3 ongoing reviews that I'll talk about one of them in a minute. And so these toolkits, which most of what work centers have, follow a pretty standard pattern of having what we call 3 levels. And the top level is what you see here, which is here's a set of approaches to tackling a particular social problem, in this case, reducing youth offending. And these are mostly preventive approaches. So it's earlier years prevention. So if you do anti-bullying programs that can prevent children from becoming perpetrators of bullying, and that reduces the likelihood of them engaging in offending later in life. And so typically these portals or toolkits, intervention tools, they go under various names, have 3 metrics. One, the last column is the impact. And here we used a categorical rating of low, harmful, beneficial, and so on. I think it's high, medium, and high we use. And that impact rating is based on systematic review evidence, but we also tell you how strong is the evidence quality, which is based on assessment of the size of the evidence base and how good the studies are in that evidence base, and the quality of the review itself that goes into the evidence base, into the toolkit, and then the cost of the intervention on a 3-point scale. Then this is the top level. You can look at any one of those programs and click down to what we call the second level of the toolkit, which gives you a fuller description of the program, what the intervention is, and it talks about any sort of what we know about implementation issues, what we know about moderators. So it works more with this group, that age group, than it does with this age group, for example. And each of these items in the toolkit here, the top level with the impact ratings, and then second level where we have a more detailed content, is based on a technical report. The technical report is the third level of the toolkit. So currently there are 13 approaches in the toolkit, and a team from Campbell, myself, and from Cambridge wrote these 13 technical reports you'll find on the website. And those technical reports are based on systematic reviews. They're based on Campbell systematic reviews where we can find one. But if there's no Campbell review, we'll look for another high quality review. We do a quality assessment of the reviews and pick one of the high quality reviews that fits in the scope of the approach we're interested in and use that to write a technical report. Where did we find these reviews? Well, prior to starting on this work with YEF, we did an evidence and gap map. So the evidence and gap map, and I'm assuming everyone here knows what an evidence and gap map is, the evidence and gap map has over 2,000 studies, of which over 200 are systematic reviews. So we've got around 250 systematic reviews in this map. So when we decide to use a particular approach, we say, okay, what reviews have we got? How well do they fit our scope? We did actually do supplementary searching to look for additional reviews that might be in the scope, and sometimes found some because we'd missed them or they were more recent since we did the search. But basically, the rationale here is that this is a strategic use VGMs that I've spoken about before, that you want to make these top level products like the toolkit, and that's based on reviews, but you need to have the reviews to do that. So the evidence maps survey the base of the pyramid. It tells you about the primary studies and the reviews that are there that you can use to build the top level of the pyramid. And actually, importantly, because we use in the technical report, we include implementation evidence as well. And most of the reviews that exist at the moment are effectiveness reviews. So they have effectiveness evidence, but they don't have implementation evidence. So again, using the map, we identify process evaluations because the map includes both impact, effective studies and process evaluations. We find from the map process evaluations for that intervention from the UK and Ireland. and we do a qualitative thematic synthesis just of that set of studies. It's normally like 3 studies or so only. Sometimes it's 6 or 7. And so we do a qualitative thematic synthesis to talk in the technical report also about the implementation issues which can arise with these particular interventions for that particular approach. So this is a strategic use of EGMs to map the evidence base to identify suitable research to build the top level of the pyramid. So there's a forthcoming CEDIL paper called Strategic Use of Evidence Gap Maps that talks particularly about this approach and actually does talk about the YF example along with several others. So as I said, EGMs not an end in themselves. We normally do them as a step towards further work, and YF commissioned the map with this intention. This is why they commissioned the map to identify what reviews are there, what reviews are needed. They're commissioning reviews, so using the map to identify reviews to commission, but also identify where reviews exist so they can build the top of the pyramid. Okay, part 2, using theories of change to inform EGM frameworks. So the framework for an EGM, most EGMs are effectiveness maps, so they have interventions in the row headings, outcomes in the column headings. Then they have filters, which are things like the population characteristics by age, by disability, humanitarian setting, and so on. And they're usually important moderators in any effectiveness analysis. So the moderators we find in studies can actually, or the suggested by theory of change, can apply as filters in the map. So some EGMs have a very broad scope. So one of the first ones we did in Campbell was the child welfare mega map. It looks at all child welfare in developing countries, so health, nutrition, education, child protection, and so on. So it's very broad. And it was suggested to us, well, you should have a theory of change. And we thought, well, but it's just too broad. So your theory of change would look something like this. You do stuff, things happen, people are better off. And seriously, when I was at 3IE and we insisted that our researchers produce theories of change, a lot of them looked like this. They said, we'll have some inputs, and have some outputs, and that leads to some outcomes. We need to find the outcomes. And that I mean, literally with those words. And so no difference to we do stuff, things happen, people are better off. Clearly this is of no help to anyone. So actually, there's an earlier CEDIL presentation I did on sexual reproductive health and rights, which took us at starting point the Dutch and the Ministry of Foreign Affairs, Netherlands, theory of change based on their strategy, because it was paper done for them, and it was more or less like this. You know, it had some specifics in there, but not at the level of detail allowed actually making decisions around programming and so on. But there are exceptions. It's possible to have theories of change which cover the scope of a map. So they're broad like a map, but do contain specifics. So an example of that is a map we've done on transport. Again, it's funded by CEDIL. It's in press now. Both the Campbell version and the CEDIL version are both in press. They should be coming out, if not this month, then next month. And that theory of change actually was, I say it myself, I did it, was very nice in terms of really helping inform the map. So I'll come back to looking at the theory of change in a second. But when we started on the transport map, the question was, first of all, what's the intervention here? Because when I first started, I thought we're looking at interventions related to transport systems like road pricing, for example. But then I thought, but actually the transport itself, the infrastructure or the railway train or whatever, that is the intervention. We're interested in does investing in railways make a difference to set of economic outcomes and so on. And so we were interested in all types of transport, so we've got some pressure to restrict the scope. We said, no, we're interested in all transport. So there are 4 main categories of transport: roads, rail, waterways, and air transport. So we're looking at all 4 of those. That was clear to me. We want to cover everything. We know there weren't many studies for air and waterways, and there aren't. But let's try and cover all 4. But what are we looking at in terms of the interventions? And there was an existing literature review which had a categorization which we based ours on. It's not exactly the same, but it's basically infrastructure, which is investment and maintenance of the infrastructure itself, including any rolling stock and so on. Information and incentives, which broadly goes under incentives. We broadly categorize incentives as things to try and change behavior. And then institutions, policy, regulatory environment, all of which goes under the label institutions, if you understand institutions broadly in the sense that institutional economics understands institutions. So it's not like just actual institutions like a hospital or whatever. It's the sort of regulatory framework is an institution as well. So we've got these three I's of interventions: infrastructure, incentives, and institutions. And that's it came from looking at existing literature to inform the framework. But it worked really well. I've not seen any map that has this other than this one, where we've got a symmetric information topology. And by a symmetric information topology, I mean that we've got the same categories labels as we have, same category subcategory labels for every category. That's not usually the case. And when you've got that symmetry in the intervention topology, it means you can actually switch them. So in the left hand here, I've made the left-hand table, I've made the transport type, the category, and then the three I's for subcategory. And in the second table, I forgot to put the labels at the top of the table, I've switched them and made the three I's the categories and the fourth mode of transport, the subcategories. And of course, you can always collapse a map by its category. So you can show the map just for the four transport types or just for the three I's. And all of those are actually interesting. So you see that when you collapse it, most literature is about roads, but some of it's about, there's some about a very rapidly growing literature about rail, particularly in China, where the railway network is expanding at amazing pace, and number of studies around the impact of railways is growing equally rapidly. But waterways, very little bit from China, hardly anything else, and air transport, again, hardly anything. Or you can collapse it by infrastructure incentive institutions, which makes it interesting, where you see nearly all the literature is actually about infrastructure, very little about incentives, and hardly anything about institutions, even though it's recognized amongst transport experts. One of the comments we got on our protocol is that the major issue in much African transport, particularly road transport, is not actually poor infrastructure anymore. It's actually the quality of institutions that where you have transport cartels and so on. But there's hardly any studies around that, as there aren't on African waterways, which are something to watch for. But the map, the theory of change here, go back to it, also identifies some things I hadn't really thought of. So that when you build infrastructure, the transport infrastructure construction there, you displace people. And road construction displaces people. We do know that, but actually it's not studied in effectiveness studies. So when we develop a framework, we pilot it against studies. And so we go through a process I call revise, refine, define, where you modify the framework as you're piloting the studies. But if the studies don't include particular outcomes or interventions, you're not going to pick them up through the piloting. And studies don't look at displacement. So we wouldn't have picked it up. And then we think about the theory of change and casting on it a bit more broadly in thinking about, and there's 4 existing articles with theories of change that we use to make this theory of change. That we recognize displacement as an important outcome from the project. And similarly, there are other outcomes are not commonly measured. Environmental impact, which we had thought of, but thought would be much more looked at. It's hardly looked at. And then there are intermediate outcomes of importance, some of which is meant to be the bullets in the wrong place. So intermediate outcomes are things like location decisions by firms and households, property prices, which is studied somewhat in the Asian literature particularly, and transport use patterns. How do people change their transport use as different transport modes become available? And impact evaluations, because they tend to look at final outcomes, often don't look for intermediate outcomes, actually what are driving the results. So this theory of change really helped us focus on thinking what the important intermediate outcomes were, the mediators that really are necessary to understand actually how the effects are occurring or not occurring. And I call this a mid-level theory because clearly mid-level theory, as I'll discuss in a second, is one that is sufficiently high level to cover a broad range of different interventional project types, but not so high level as to be too abstract to generate meaningful conclusions or implications for research. And this one clearly does generate meaningful implications for the research and the framework that we used. And it cuts across different types of transport, so it's mid-level in that sense. It cuts across the different main types of intervention, the 3 I's. So it's mid-level in that sense. Okay, so finally, using theories of change to build a bottom-up mid-level theory. So mid-level theory, as I just said, sits between general theory, which is too abstract to be useful, like the one I showed before, and project theories, which apply to individual projects. Now, work on mid-level theory is one of the programs of work we have on actually principally driven by the need to try and transferability of study findings from one setting to another, to think about the underlying causal process and assumptions that would allow that transferability. And we have a working paper and a methods brief on mid-level theory on work led by Nancy Cartwright. And what Nancy does in the paper, and she uses the example of conditional cash transfers, is start with a fairly high-level process for theory of change, and she calls the process of taking that theory down to a specific setting. So mid-level theory can operate at various levels between the highest level we have general theory, and then you've got the lowest level is product theory, and there's various levels which can be mid. And so she takes this process from the sort of top mid level, which is fairly abstract and general, down specific contexts by a process she's called thickening. So I call that a top-down approach. Here's our high-level theory. Now we can thicken it by adding in details about the specific intervention we're looking at to tease out the causal process and assumption that apply that particular intervention. The alternative way is take a bottom-up approach. And the bottom-up approach will say, take individual project-level theories of change and then aggregate them to identify the common causal processes or common assumptions that fall across those different projects. So you aggregate up the projects, or you could aggregate across academic theories of change to get a mid-level theory that encompasses all those different projects whose individual theories you've aggregated into mid-level theory. And this is the approach we're taking with the youth employment work we're doing that Thomas will speak about. And you can see, you can do this on existing theories of change, say in existing project documents, and that'd be what a qualitative framework synthesis. So qualitative synthesis often starts off not knowing what you're going to find, so you develop the framework in a literature way. The framework synthesis says, now we've got some idea what we want to look for, here's our framework. And so the theory of change approach provides a framework for the synthesis of theories of change in project level theories of change in project documents. So that's what we're doing, which Thomas will talk about it, but we're just starting. So he hasn't got findings to result, he's just going to present the idea of what we're doing. But here's an example from sports interventions for youth at risk of offending. This is a review we've done for YEF. The review is in draft now. And there are a lot of academic theories. I realize you won't be able to read this table, but there are 20 odd different academic theories or more explaining how we might expect sports interventions to reduce. I'm getting WhatsApp, so I'm clearly talking too long. Yeah, I'm going to stop in 1 minute. Sports interventions to reduce offending. And I just mentioned a couple here. So one is recapitalization theory or surplus energy theory, different names but same theory. Basically, you've had lots of excess energy, they burnt off with sports, they're less likely to use it in other antisocial ways, so reduce externalizing behavior, aggression, offending, and so on. The other is boredom theory or diversion theory, which is that basically kids get bored, they have nothing to do, so they get involved in antisocial behavior and offending. So giving them something to do will reduce that. Here's our overall theory of change. This is my last slide. I'm not going to go through the detail because of time. You can pick out in this theory of change different interventions that we have under sports and what's called Sports Plus, and the causal processes that they operate on, which are different for the different interventions. Okay, so I'll skip that slide. Just say it does work. Sports does work. So we're putting this approach into practice for youth employment, and Thomas is going to talk about that. Thank you.
Thomas, over to you. You need to unmute yourself.
Okay, thank you. Let me just share my slide. I've seen my full screen.
Yes, we are. Thank you.
Okay, thank you. Thank you, Howard, for the presentation. So I'm going to present coming from what Howard has also been presenting. So this is a theory of change for youth employment that we are working on. This is a project we are working on. We finished doing the evidence and gap map for the impact evaluation. So apparently we are looking at we are also updating this EGM by adding the process evaluation studies. And after that, we are going to look at the theories of change, as just like how Howard has been talking about. So I'm just going to present the theory of change that we are having so far for the youth employment. So just to give a small background, YFF has been supporting youth employment EGM, and this was earlier presented by Robert Aponyo last week, where he showed the EGM of the impact evaluations that was the paper that we finished. And as I've just said, we are currently updating the process evaluations. We are also in the ending phases of this project for the process evaluations. So after that, we are going to undertake the qualitative thematic synthesis of the process evaluations. And these ones will help us. After that, we shall start with the synthesis of the theories of change. And we shall be using the bottom-up mid-level theory approach, which Howard has been talking about. That's what we are going to use when we are coming up with the synthesis of these theories of change. So just to give a small introduction about theory of change. So you're going to realize that most theories of change document the causal links between, you always have inputs, activities, outputs, and intermediate and final outcomes. So what on top of these, you need to put underlying assumptions, and the underlying assumptions are very good because when sometimes you may, after giving this intervention, you may not get the results that you intended to get. So that's when you go back to the underlying assumptions and you see whether actually these assumptions were met. And then you can ask questions as to why you didn't get your outcome. So underlying assumptions are very, very essential when it comes to the theories of change. So also just to say, the theory of change was developed by Weiss in 1998. And you're going to realize that this has become a common approach to most of the program designs, the theory of change. So there comes the question, what are the steps when you're building a theory of change? The first thing you need to do is you need to really define your intervention. You need to know your objectives and your outcomes before you start coming up with a theory of change. Then you need to lay out the main steps in the causal chain. If you looked at the theory of change, Howard has just presented, the kind of arrows are the ones we call the causal chains. Then, as I said before, you need to identify your underlying assumptions. Underlying assumptions are very critical because they also help us in case you get results that you're not, you didn't intend to get. It helps you to answer some of the questions that may come up as to why you didn't get the results you intended to get. So you also have to add a temporal dimension to plan for the impact evaluation. So you need to know when you're going to do the impact evaluation, which types of data you're going to collect, when are you going to collect, are you going to collect all the results, the outcomes that you intended, or are there some outcomes that you may never get? So these ones you need to plan for them when you're doing the theory of change. So this is what I've just talked about. You need to evaluate the key questions, and this can help. This mainly you need to do, you collect factual and counterfactual data to try to answer these evaluation questions. So for the factual can be, for example, the people getting the intervention they need, vis-a-vis the counterfactual, whether the intervention works. Because just when you think about it, sometimes you may never get the intervention because the intervention is not reaching to the right people. So the factual part is the one where you try to ask, is the intervention going to the right people? Are they giving them the real intervention? Is the target population receiving the intervention? Something like that. So then the counterfactual is where you're trying to see whether, what if there was an absence of the intervention? Would there be an outcome that was seen? So those are some of the questions you try to ask when you're doing the theory of change. And then another thing is you need to validate and revise with key stakeholders. So you're going to realize that most times as researchers, we tend to think for people. Sometimes you find an intervention that is already rolled out, and you think that this intervention is supposed to do something X, yet probably the stakeholders put out this intervention because they wanted to attain some other outcomes. Actually, to give a good idea about this point, if Howard always gives an example of where, I think it was Bangladesh, where they used to give cash transfers to schools, and then when they were doing the theory of change, actually they thought that they were giving the cash transfers to aid students to go to school. But actually, when they went and talked to stakeholders, they realized that their main aim wasn't to give to make students go to schools. Actually, it was to depopulate some of these schools. So sometimes you need to go and talk to the stakeholders to make sure that your theory of change, especially your interventions, are in line with their thoughts. So just to give the objectives and outcomes of interest, for our project, we are trying to look at the interventions that are helping to increase youth employment. And this is both on quantity and quality. And then for the qualitative part, we are trying to look at the barriers and facilitators to the successful implementation. And this is where the process evaluation comes in. Then in the end, we shall see the achievement of the outcomes of these interventions. So the first part is mainly the impact evaluation, where we did the EGM, the first EGM. Then the second one is the one for the process evaluation that we are looking at. We are looking at barriers and facilitators for the successful implementation of these interventions. So the outcomes we are looking at are mainly the quantity and the quality of the employment, then the number of people that are employed or unemployed, whether these people are having permanent or temporary jobs, whether these jobs are full-time or part-time. That is actually some of the things we are trying to look at. Then when it comes to quality, we are looking at pay and conditions, where these people are having good pay, and maybe when they're at work, whether they're having the right conditions, the good conditions for when they're working. So that comes even with the working conditions. That's what we are trying to look at. And whether these companies are also looking at worker rights. So to look at the typology of the interventions we are looking at, mainly we have what we call broad categories, and those are the ones that are on the extreme left, and then we have subcategories. So we have broad categories, we have training, upskilling, and retraining, and these ones mainly look at whether the youths are getting the training they need, whether they need us, if they have lost the skills, whether they're getting reskilled. So this is where reskilling and retraining comes up. So you'll have things like the prior learning, assessment and recognition, education, TVET, which is technical and vocational training, internship and apprenticeship, training center accreditation and certification, and then business skills training. And these ones help to boost they help to boost the skills of these youths. Then we're also looking at the support to employment, and this mainly looks at whether the youths are getting the necessary help in order to get the employment. So you think things like employee mentoring when they go to school, to work, things like public work programs that help them to get skills. And then we have things like decent work policies, which look at social protection, they look at labor standards, they look at policies at national levels. Then we have information whether the youths are getting the right information, for example, the labor market information, what is out there. Then another thing we're looking at, another subcategory, the main category we're looking at is entrepreneurship promotion. As we realize, entrepreneurship helps people to go into self-employment. So in this case, we look at loans, guarantees, cash, material grants, and self-financing groups. So there are many causal processes that we can look at when we are coming up with this theory of change and these outcomes. One of them is the simple one that I'm just showing up here. So you just have skills training. Then, of course, skills training, you anticipate it to lead to improved skills, which also leads to increase in quantity and quality of the youth employment. Another one is the wage subsidy, where in this case, mostly the firms that are employing these youths are getting a subsidized, you get a tax, probably a tax waiver, or the government is trying to pay for you a slight amount of money so that you take in the youths for employment. So most times this one tends to lead to increased labor demand, and increased labor demand tends also to lead to increased quantity and quality of the youth employment. Another one you can look at is the SME financing, which can lead to new businesses. That is the self-employment, and self-employment also leads to improvement in quantity and quality of the youth employment. Another one we can look at, another causal pathway, is this one, which is a bit more complex compared to the first one. So we have skills training, which can be part of vocational training, life skills training, business skills training, and these lead to both social skills, business skills, life skills, hard skills, and these ones tend to lead to employability, then good employee, and then when it comes to business skills, it can lead to self-employment, which also increases the quantity and quality of the youth employment. Another one we can look at is this one, where we are trying to look at mentoring as one of the biggest category. In this case, mentoring can be careers advice, life skills, business mentoring, and these ones lead to efficient jobs as such, personal skills, social skills, business skills. So when you get all these, they will improve employability of the youths. It will lead to good employee. It will lead to starting of businesses, which I call the self-employment. And when you combine this tends to lead to our final product, which we call the increase, which we want, which is the increase in quantity and quality of youth employment. So these are some of the pathways we can look at to see how to increase how to increase the quality and quantity of youth employment. Another one I wanted to show you is the one which is a bit complex. So this is the theory of change, which has interventions, inputs, activities, outputs, outcomes, and impact. If you realize the endpoint that I've been talking about is we want to improve the youth employment, especially in quality and quantity. So this theory of change tends to look at what we call starting with the end in mind. So in the end, what we want is the impact. In this case, the impact is the youth employment. So the question is, what can you do? Which outcomes do you need to get the youth employment? So one of them is the internship. So how do we get internship? Those are the outputs that we always get. If you see, for the internship, you will need the inputs, the activities that you'll need for the internship. You'll need a government creating microfinance fund centers, attracting donors, establishing business training centers. So these ones tend to improve. They help in getting grants for the youths so that they can allow them to get their own entrepreneurship skills and to have businesses running, because the grants help to boost their capital. Things like loans, then it leads to policies created. So if you look at this line of theory of change, you're going to realize that the intervention here we are looking at is the grants, loan guarantees, microfinance, business mentorship, crowdfunding, and franchising. So another route we can look at that can lead to improving youth employment and the quality and the quantity is employability of youths. So this also has its own line of thinking. So in this case, the intervention you're looking at is employee mentoring, which is the on-the-job training, wage subsidies, career guidance, employee mobility, and placement. So if you look at these, when the youths get these kind of interventions, when these interventions are in place, they will lead to the youths getting hard and soft skills. They will lead to these youths getting on-job skills, and they will also increase the job opportunities for them, which in the end increases the employability of the youths. And as we say, the employability of the youths improves on the youth, the quantity and the quality of the youth employment. Another line of thinking would be getting, the one that is very common is the youths getting the employment skills. So in this case, you have things like the TVET, that is the vocational and educational training. Then you have also training of trainees. These ones, the training of trainees helps to give skills to the people who are supposed to pass on the skills to the youths. So another intervention would be business skills, internship and apprenticeship, and then the life skills training. So these ones help the youths to get hard skills, soft skills, life skills, and these ones in the end make the youths to get more employable. And when they get these skills, they improve the quality and the quantity of the youth employment, which is always our end goal. So as I said before, for every theory of change, you need to have assumptions. So some of the assumptions that we can look at with our theory of change would be that these youths are actually willing to learn. So if the youths are not willing to learn, then they won't get these skills that they're talking about. Another one is that the trainers have also the needed skills. They're also skilled enough, and they're also available to teach, because you might have these interventions, but when the trainers are not around to pass on the information. Another one is availability of funds. You're going to realize that most interventions actually require funds. So this is a main assumption that you always have. We also have government buy-in. Government buy-in helps with things like policies and things that tend to be at a government level. So you need also government buy-in. You need a favorable and regulatory peaceful environment. So if you're in a place that is a bit that has insecurities, you may never get the outcomes you needed, because then the youths can't go for things like vocational training. They can't go for reskilling because they're fearing the instability in the country or something like that. Another one is you need to have presence of the well-equipped training centers. So you need to have farms where these youths are going to get the skills. You need to have the training centers where these youths are going to have these skills. So these ones help you in the end to get skills for these youths. So we also, another assumption would be the low attrition rates, because if you have a lot of loss to follow up of the youths, then you may never get your intended outcome. So that is the theory of change that we're looking at, and I want to thank the people who have helped in developing this. So the Africa Center in Makerere University, Uganda, the YFF, and the Campbell collaborations. Thank you.
Eve, would you like to come in? Or shall we proceed straight to some cross questions between Howard and Thomas? We're running a little bit behind schedule.
Yeah, we can proceed to the questions. Thank you.
So we spoke quite a lot. I think maybe we can open up the floor to the fishbowl. If we can get volunteers to come to the fishbowl, that would be good, because otherwise we'll run out of time for it. So let's try that. If it doesn't work, we'll go back to the chat between Thomas and myself.
Thank you. So just to remind our audience that if someone would like to join the fishbowl, the virtual fishbowl, they need to share their audio and video and say that they would like to join in through their comment boxes, so the moderator can let you in.
Okay, so Sabine has volunteered. Sabine, can you click the share audio and video box? Yep, there she is. So the moderator will let her in. There she is. Something worked in Hopin. Very good.
So thank you both, Howard and Thomas. There was such enriching presentations, and I learned a lot from both the presentations. So I got a couple of questions, but I don't know we have that much of time for taking those questions. But a few questions, like for example, I would just call this serendipity. That I was in the afternoon, I was just thinking about this kind of this concept that you talked of symmetric intervention typology, but I didn't know that such terminology exists. So, like, is it possible to place the filters instead of intervention subcategories also in place of, like you showed, that the interventions and the sub-intervention categories can be swapped? So can we do that? Can we also do that with some of the filters? For example, yeah.
Right. So yes and no is the answer to that, because so the way the map works, as you know from working on them, is that you can map. The advantage of every mapper is you can you can map anything you've coded. So you can certainly make filters the row or column headings, and we've done that quite often in several maps. But to have this symmetry, I just made up the word today as I was preparing the presentation, so I'm surprised you didn't hear it, not surprised you hadn't heard of it before. But I knew this. We had this feature in the transport map. To get this symmetry, you'd have to code the filters embedded in the intervention categories. So, which you can do, so if you've done the coding in EpiReviewer, it would not be a very large task to make a new coding category for that purpose, because you can do it for manipulation of the codes. Yeah, so EpiReviewer is a bit clunky to doing it, but it is possible to basically make a new set of codes that would have the filters embedded in interventions and vice versa. So actually, it's a good idea. You could do that, and then you can produce a map either way around, because you'd have the symmetry.
Okay, thank you. And another question was like, what are the dangers of making a theory of change crowded? Like, for example, if we add up, like, or do you think that it is advantageous the more crowded or the more nuanced the theory of change is? Like what are the advantages or disadvantages to both the sort of scenarios?
Right. So there's a very nice quote I use a lot from an economist called Joan Robinson, who's a Cambridge economist in the 50s, and she has this nice line that she's talking about modelling. If you produce a map with a model with too much detail, which tries to replicate the full detail of the real world, is as useful as a map of a scale of 1 to 1. Yes. So a map of scale to 1 to 1 is it's the same size as the real thing you're mapping. Yes. So when you try to put too many details into a model, the whole point of a model is to abstract from all that detail to focus on the key elements. So we want to focus on the key causal processes. So it's not quite the same point, but when we do the framework, and we always do engage, I really like Thomas's line. I tweeted it. As researchers, we tend to think for other people. so we do, in our maps, make sure we don't think for other people. We do a lot of stakeholder consultation around the framework, but the pressure from stakeholders always is to include more and more detail into the map framework. So any specific intervention they work on, they want to see it named in the intervention categories, and you can't do that. You can't have a map of scale 1 to 1. It's useless. So once we had a case with homelessness where we had like 40 odd categories, and we said, okay, we're going to have consultation and we want to get down to 25 categories, and they came out of 89 categories instead. So they just kept adding stuff in, and it's a map that scale is impossible to navigate. It's impossible for the coders to know where to put stuff, users to know where to find things, and you can't navigate a map that's detailed. So similar to the theory of change, and that's the mid-level theory is made for reviews, because reviews cover a broader range with a single intervention, a single project. So the idea of a theory that cuts across all these different interventions is really very appealing for systematic reviews, because they are trying to distill evidence from a range of interventions are in different contexts, different outcome measures, different designs of the programs, but nonetheless you think it's a useful exercise to say, taken as a whole, how are these things working? So sports interventions are in schools, they're in communities, they're in prisons, and they're basketball, they're drama, there are lots of different, well, not drama actually, but they're yoga, lots of different things. But still we think there is, some common set of causal processes by which these things are meant to work. And so it's that level of abstraction you want to get. And so going into detail about the precise nature of physical activity or the sport, or it's too much. You lose. When you look at a picture too closely, you can't see the picture, or you can't see the wood for the trees. So you want to see the wood for the trees. And mid-level theory, I think, really helps you do that.
Thank you for responding to that. And one last question, and maybe somebody else can also volunteer to ask if there is more time. So this question is like a very hypothetical one. For example, let's say there is a sort of systematic review for which we are to develop a theory of change or mid-level theory. So, but there isn't much literature around that. So can we use commonsensical sort of assumptions like Thomas presented in his presentation, that we can start with some, but his assumptions were like of different nature. But can we just sort of intuitively think of this intervention could lead to these intermediate outcomes or these outcomes? So like, does that make is that allowed?
Let's Thomas, why don't you take that one, because that's sort of what you did for the employment one to start with.
Yeah, and that's the whole point, because then that is where first of all you have to first think about it, and after thinking about it, you go back and revise. So you do the revising, so that you think you think through it and you see whether it makes sense. To me, I think it was okay.
Thank you. Thank you for giving me this opportunity to interact with the panelists. And maybe somebody else wishes to, if the chair permits. Thank you.
Thanks, Sabrina. Do we have another volunteer from the audience?
We can take a bit of the break time, I'm told. So if there's anyone else that wants to come in the fishbowl, they're more than welcome.
I have a question for Howard as potentially somebody comes in. Yeah, it seems that we now have a push towards program designs being underpinned by theories of change. And I wonder what the implications are for program design practice. Should we always think of formative research or systematic reviews before designing programs? And how feasible is this? Thank you.
Right, thank you. So if you read Nancy's paper, and Nancy worked on this in sort of very from academic perspective, and then we had a presentation, we had a meeting in DFID, as it then was FCDO, where she was presenting just to a couple of people, and I mean she was quite surprised to learn the extent to which that isn't done. And her view was that really, how can you possibly design a program about knowing how it's meant to work? And the fact is that there are so many things that we just assume. I mean, practitioners just say, "Oh, we've always done it like this," or "Oh, we know it works," or like, "Oh, it's just so obvious that it's going to work, so why would you question it?" So, one of my best known examples, actually, how I know Nancy, because she uses an example from me herself, is the Bangladesh nutrition program, and where you're giving supplementary feeding to young children who are malnourished and telling their mothers how to feed the children better. How could that not possibly work? Well, it didn't work, and the theory of change explains why. And I don't say nothing works, but I do believe in the 80% rule, that 80% of things don't work. So much of my career as an evaluator, which goes back over 30 years now, has been saying things don't work and this was the reason. And people always say, well, why didn't they think of that at the time? How could they possibly not have realized that was not going to work? And the answer, and I've seen things where I just think, there's no way that's going to work. Why can't they see it's not going to work? Even before they started, I think, it's just, we know that won't work. And so having a theory of change should actually help you do that. And I'm not very big on semantics, and so people argue about the difference between the log frame and the theory of change. So the log frame laid out the steps in the causal chain from inputs to activities to outputs to intermediate outcomes, final outcomes, and so on. And if done properly, there was also sort of an assumptions and risk column, and that's what I put into a theory of change. And I've got a couple of online videos on theory of change, and one on YouTube. One of the comments was, obviously in theory of change, it's just like a sort of log frame put in a different format. But I actually don't think there is an awful lot of difference. Some people say, well, theory of change is sort of more dynamic and blah, 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 that stuff. I don't believe in it very much. But theories of change, as they are seen, can be sort of dynamic. There should be a time dimension. They can have feedback loops and so on. And so I'm going a bit off topic here, so I'll go back to the topic. So yes, I do think they should do them. So actually, there's a group called eBase in Cameroon, and the first time I met Patrick Oakwood from eBase, he came up, he met me at a conference. He came and told me, "Oh, what that YouTube video you have on theories of change? They show it in villages in Cameroon. They show it in the village, the video, and then they say, okay, that's how you do a theory of change. Let's now do one." As a village, to identify the problem we want to solve, and let's do a theory of change to solve that problem. And so, villagers in Cameroon can draw up theories of change, were facilitated. One would hope that NGOs doing, or government agencies doing programs, can design theories of change to understand how is it you think this program is going to work? Well, what are the assumptions behind what this program working? And they're just common things that go wrong, like just not telling people about a program, not reaching out to the right audience. People don't think about how they're going to communicate, about how the audience, how the people they want to reach, but how they're going to know about the program, or they just put events in the wrong time and place, or don't have someone that can speak the local language, and all these things just go wrong that are obvious. That you thought it through. What do we need to make this program work? And when I do a theory of change workshop, what by exercise I do is, okay, we've done the theory of change. Now we're 5 years into the program. It's not worked. What went wrong? And so to make people think critically about their theory of change, and like, okay, this is meant to help us identify what we need to have in place for it to go right, and also what might go wrong and what we can do to prevent it. What Nancy calls them, I'm going to forget the word now, but she has the enablers, the things that help you overcome what might be the barriers, or the she has another word for it, but the barriers to success. And I think that approach is very helpful. So yes, everyone should be doing, and it really is not that difficult to do a good theory of change. And I strongly support looking at reasons. I've done it all my career, all my research back to my PhD. I've always looked at why is it things are meant to work? What the causal mechanisms? Let's try and unpack those. And it just seems really weird to me to do an intervention and not think about that. I'm hoping someone else will volunteer. We've got a lot of people I know there in the audience, and I don't want to call anyone out by name, but I hope someone else will come and join us up on the stage for our virtual fishbowl.
And then, Howard, there is that pyramid, the pyramid that you shared, where we have data, the primary studies, the systematic reviews. Are there some assumptions that underpin that? For example, you might have a field where you have more of very weak studies, and then you have a field where you have more studies informed by robust study designs.
Right. So the pyramid is purely descriptive, and there's no sense in which, well, if you do this, it will definitely lead to that, because it won't. It enables the higher levels to be built if you have the lower levels. And you could do a map if there's no primary studies or reviews. You'll just have an empty map. So you can always do some of the higher levels, but to do the top 3 levels, the toolkits, guidance, and guidelines, you do need to have an evidence base on which to build that. And so the pyramid is meant to show is a descriptive heuristic to help you understand the status of the evidence architecture. So I have done a paper, it's a chapter in a book, comparing the evidence architecture in health and education. And so I forget exactly the numbers, but there's a review paper of RCTs in education. It's a couple of years old now, and it found around 1,000 randomized control trials in education, whereas in health, the Cochrane Clinical Trials database has 1.5 million trials. That's a big difference. Systematic reviews, again, they're actually around 1,000 reviews in education in total. And there's a database called Epistemonicus, which is a database of health systematic reviews, has 38,000 systematic reviews. So again, a huge gap. And then, of course, at the global level, so at the bottom of the pyramid with data, you have things like COMET, which is a core outcomes initiative to try and get researchers use a common set of core outcomes, and they do health research, so results are comparable between studies, whereas in many social sciences, any researcher just makes up their own new indicator when they do a study, so they reduce comparability and the ability to synthesize evidence across studies. And you've got initiatives, so WHO has I'm going to forget the name now, but it has the, what do you call it, the book WHO has defined different diseases. That also helps you define different outcomes. They also have a intervention categorization manual as well at WHO. And you've got WHO higher up the infrastructure producing particularly guidelines, which have to be based. WHO has a guidelines on producing guidelines. Their guidelines on guidelines says WHO guidelines must be based on systematic reviews. And so you've got that much stronger evidence architecture in health than you have in education. So I have a blog called Why We Need a World Education Organization, because there's nothing like WHO in education or in social protection or in all the other areas we have. There are global programs like Global Partnership for Education that have billions of dollars, but they don't spend on building the evidence architecture in any systematic way in the way in which WHO does. So I call it the scandalous underinvestment in the evidence architecture, because the fact that organizations like Global Partnership for Education don't spend their money investing in the evidence architecture in this way. So you do need the pyramid to be strong, and it's most strong in health followed by education, and any other area like youth employment. We'll find so there were very few reviews in youth employment. So we've got in the map now going on for 700 studies, and there are like 30 reviews or something. Less actually, I think. So fewer than 5%. So the norm in health, you often find more reviews than primary studies when you do a map, which is a bit strange. But we would hope for 15 to 20% for studies in the map to be reviews. Once it gets less than 10%, it's under reviewed. And the reviews there are commonly into health related topics. So in the homelessness map, there were a few reviews there were on homelessness. In the employment map, there are a few reviews, and they mostly are on quite esoteric topics. We've got one central Campbell review on youth employment per se, but otherwise we don't have terribly much. And so the maps just point out there aren't reviews in this area. And that's why YF actually there are quite a lot of reviews, but they want to really populate the whole space with high quality reviews. Why they've got the 3 reviews we're doing currently, which sports is one, and they're about to commission another 10 or 12 reviews. Another question from Sabina. Okay, if we have time. Yes, I've always got time. Everyone else can go. I'll just keep talking. Okay, it depends who you are, Sabina. So asking if conceptual frameworks, mid-level theory, theory of change, logic models are synonyms, or are they different? So I think some people get very worked up about this. I don't particularly. I do think the distinction between theory of change and mid-level theory is a useful one. So the idea that theory of change for a specific project is for a specific intervention, whereas a mid-level theory tries to embrace a broader range of interventions or a particular intervention in a broader range of settings. So in Nancy's example, it's about conditional cash transfers generally around the world, and you take it down to a particular setting where you've got particular conditions, particular target population, and so on, particular outcomes, and so on. Whereas in our sports example, our transport example, we're using mid-level to embrace a broad range of interventions which have a common set of causal processes around them. I think conceptual frameworks are much broader terms. So I think MLT and TOC are subsets of conceptual frameworks. We have conceptual frameworks for other types of research that are not around interventions, that don't have a theory of change. You can have theories of change that are not intervention related, because you can just say, what are the drivers of early marriage? And that would be based on more traditional qualitative research, can be quantitative research, but different other research that has a theory of change about why early marriage occurs, what sort of drivers of change in society might reduce early marriage, and not be about intervention. So I think they don't have to be intervention specific. Conceptual frameworks are still broader. Logic models, I think, are just out of fashion, but they, in my mind, a good logic model and a theory of change look very similar. Logic model is normally a table rather than a flow chart, and I do find the flow charts useful. So a good logic model would contain all of the stuff that's in the theory of change, whereas many logic models are more of a rote exercise and don't really question the assumptions. So we saw the early theories of change. They don't, I call it interrogating the assumptions. And a lot of theories of change don't really interrogate the assumptions. They don't get at the point of why you're doing a theory of change. To me, is really trying to figure out, will this intervention be successful or not? And what do we need in place to make it successful?
Okay, thank you, Howard. I think we're coming to the end of the session, which has taken up pretty much the entire break, but well worth it. Can I just take a second to thank all the speakers and our chair, Eve. And as I said earlier, when we started, the presentation will be available on the conference platform until the end of the conference, but a YouTube recording will be available later on CEDIL website. So without any further comment, I guess, thank you very much and enjoy the rest of the conference.
Thank you, everyone. Thank you for coming. Do go to the CEDIL website, the Campbell website, the conference website. Do come to other events. Only one day left the conference. Please do come to stuff. And bye-bye, everyone.
Bye.
Thank you. Bye.